One frequent request I get over the last couple of years is liquid rhinoplasty. I believe this is due to the Instagram influence. We have people who are showing their liquid rhinoplasty results, and that gives people the idea that perhaps that would be an alternative to them, for a rhinoplasty done surgically. I'd like to explain that there are some limits with liquid rhinoplasty. It really, in my opinion, can only be used in very limited circumstances. We can use it pretty much exclusively, in my opinion, to fill in either small defects left over from a previous rhinoplasty or perhaps a previous injury, as long as those defects are in the very center of the nose, or if somebody has a slight bump, we can use it to fill just above the bump and just below the bump. It can also be used at times to lift the tip slightly and give a little bit of refinement, but once again, we only recommend using it in the very center part of the nose. Once you go off center, the risk of causing a vascular occlusion greatly increases, and you're also at risk for possibly causing occlusion that could lead to other complications such as blindness. We are very careful to consent people and inform them of what the risks are, and also to show you on our 2D and 3D imaging what the limits are compared to a surgical rhinoplasty. Many people don't realize that liquid rhinoplasties actually make your nose slightly bigger. Now, if it's just a small bump, from the front and side view, it may not look significantly larger, and that's okay. But if somebody really has a nose that they'd like to reduce in size, or they have a tip that's hanging, or they have quite a bit of tip that needs to be elevated, then a liquid rhinoplasty is probably not for you. If your nose is too wide and just a slight bit of elevation is not going to make it look thinner, and again, we can show you that on imaging to a certain degree, then a surgical rhinoplasty is probably your best option. But the only way to find out is really to come to see a surgeon who does computer imaging and can explain what would be the best option for you.